Orbital cellulitis is a serious bacterial infection that affects the tissues behind your eye. This includes the muscles that move your eye and the fat that cushions your eyeball inside what doctors call the orbit. Think of the orbit as the bony socket where your eyeball sits. This condition occurs behind a thin layer of tissue called the orbital septum. You can think of the orbital septum as a protective barrier that separates the front part of your eyelid from the deeper structures behind your eye. When an infection crosses this barrier and gets into the orbit, things become serious. Orbital cellulitis is more commonly seen in children and is most often caused by bacteria like Staphylococcus aureus and Streptococcus pneumoniae. It's important to understand the difference between orbital cellulitis and preseptal cellulitis. These two conditions might look similar because they both cause swelling and redness around the eye, but they're quite different in severity. Preseptal cellulitis is less serious. It affects only the eyelid area and doesn't reach the deeper structures of the orbit. People with preseptal cellulitis will have a swollen, red eyelid, but their eye movement is normal, their vision is fine, and moving their eye doesn't cause pain. Orbital cellulitis is a medical emergency. The key signs are pain when moving the eye, difficulty moving the eye in different directions, a condition called proptosis where the eyeball bulges forward, and potential vision problems. These symptoms tell doctors that the infection has gone deeper and requires immediate hospital treatment. The most common cause is a bacterial sinus infection that spreads into the orbit. Your sinuses are hollow spaces in the bones around your nose and eyes, located right next to the orbit. When a sinus infection gets severe, bacteria can break through the thin bone barrier and enter the orbital space. Orbital cellulitis can also develop from severe tooth infections, ear infections, or facial infections. Another cause is trauma to the eye area, especially if it involves a fracture or a foreign object. Even insect or animal bites around the eye can introduce bacteria. In some cases, it can occur as a complication of eye surgery. The hallmark symptoms are what we call the 3 Ps: pain with eye movement, proptosis, and problems moving the eye. Pain with eye movement is often one of the first clues. Proptosis means the eyeball is pushed forward and bulges out. The third P is problems with eye movement. Beyond these 3 key signs, people typically have a swollen and red eyelid. Many patients also experience fever and feel generally unwell. Vision can be affected too, ranging from blurry vision to more serious vision loss. Some people also experience double vision. It's important to seek immediate medical attention if you develop these symptoms, especially after a sinus infection or trauma to the eye area. The sooner treatment begins, the better the chances of preventing complications. When you arrive at the hospital, doctors will start with a physical examination checking your vision, eye movements, and signs of proptosis. The 2 main imaging tools used are CT scans and MRI scans. A CT scan can show inflammation of the eye muscles, swelling of the fat around the eye, and complications like abscesses, which are pockets of pus. Most patients need to be admitted to the hospital. The mainstay of treatment is intravenous antibiotics delivered directly into your bloodstream. Doctors typically start with broad-spectrum antibiotics that work against a wide range of bacteria. Patients usually receive intravenous antibiotics for several days. After the infection starts to improve, patients are switched to oral antibiotics continued for 2 to 3 weeks. In some cases, if an abscess has formed, surgery may be necessary to drain it. Without prompt treatment, orbital cellulitis can lead to vision loss. This can happen if the infection compresses the optic nerve or cuts off blood supply to the eye. The most dangerous complication is when the infection spreads to the cavernous sinus, a large vein at the base of the brain, causing a life-threatening condition. The infection can also spread to the brain itself, causing meningitis or a brain abscess. The good news is that with early diagnosis and appropriate treatment, most people recover completely. When caught early and treated with antibiotics, patients usually start to show improvement within 24 to 48 hours. Complete recovery typically takes a few weeks. If you found this video helpful and want to learn more about eye conditions, make sure to subscribe to our channel and hit the notification bell.